Welcome to Session 4. We're going to learn how to take advantage of the wellness opportunity by effectively communicating client health status using the longevity, vitality, and aesthetic indexes. The wellness indexes allow you to link behaviors directly to health status. In this session, you will also learn specialized low health literacy wellness terms, such as endotyping and stage, to help inform and motivate your clientele.
Welcome to Session 4, Communicating Wellness. I'm Pete Wisniewski.
And I'm Chad Earl.
Let's give a little introduction to wellness theory. Wellness is a multidimensional state of being, describing the existence of positive health in an individual as exemplified by quality of life and a sense of well-being.
Let's put that into some common language. And what that means is, wellness, unlike fitness or medicine, in the sense that you can't achieve it statically. We're not going to focus on getting well. The focus is being well. It's how you associate stress in your day-to-day life. A lot of people try to avoid stress, but the reality is that stress doesn't make you unhealthy. It's the ability to manage it with behavior that creates the outcome. It's not the stress that you're under. You can look at that stress as a physical way. You take an athlete who, during the season, breaks down through injury. Well, a lot of athletes with that same stress don't get the injury. The difference is that athletes' recovery strategies, their nutrition, and their post-activity management. Secondly, you take a look at somebody's emotional stress. Things happen with people. You have death, you have loss. How do you manage these things? Do you drink? Do you smoke? Do you use pharmaceutical enhancement to get through the day? Or do you eat highly nutritious meals, do aerobic exercise, do meditation or prayer? That same stress in some individual will create disease, and in other individuals it will build relationship and greater health. Let's take a look at the three wellness indices: longevity, vitality, and aesthetics. And we've defined them down there for you in our program. But quite simply, in your mind, you could think about longevity is the ability to live well with your age. Secondly, you can look at vitality, and that is feel good for your age. And aesthetics is looking good for your age. And as you apply these indices to the client, they can expand health beyond their age, and that's the indices' true magic. Let's take a deeper look at the longevity index. The longevity index is calculated using the objective laboratory data, health history, some subjective behavior information, the medication burden, in-office vitals, dietary intake, and limited anthropometrics. The longevity index is related to client goals, such as lowering their medication dependence, losing weight, reducing some of their morbidities, enhancing laboratory values, and decreasing their disease progression currently in their body. Vitality is calculated by measuring physical capacities, such as strength, endurance, flexibility, looking at an expanded anthropometric data, behavior survey, and then in-office measurements. The vitality index is related to client goals such as increasing their libido, improving their body composition, decreasing inflammation, and upregulating their joint range of motion, balancing their hormonal patterns, and improving their stamina and physical abilities. Next is the aesthetic index, which is calculated by recording anthropometrics, the dietary intake, the behavior survey, and health history. The aesthetic index is related to client goals such as improving body composition, improving skin quality, improving hair and nail quality, improving subcutaneous fluid levels, enhancing fat loss and weight management, and lastly, improving attractiveness and overall body symmetry. Lastly, we need to understand and objectively evaluate the client's behavior. To do that, we've identified some key behaviors that clients need to minimize or maximize to help them achieve and maintain their ideal wellness ranges. Some of these goals happen to be routine physical activity, a nutrient-dense diet, seeking medical care when needed, managing their alcohol and sugar intake, restricting their tobacco and recreational drug use, and seeking education or understanding when their lifestyle dictates.
The behavioral index is calculated by recording lifestyle recovery choices in respect to physical, emotional, and mental stressors. We use this to track compliance, predict outcomes, and modify program recommendations based on their communication preference, which we'll get into next. The behavior index is a combination of physical, emotional, occupational, spiritual, social, and intellectual behaviors.
We want to now look to create a definition for wellness to our client base. And quite simply, to do that, we take the LVA indexes, average them into a score, take it times the behavior to create a comprehensive goal that we can then manage to in clinic. We now want to understand a practical summation of wellness. And to do that, we need to take the LVA indexes, add them together, and create an overall scoring. Because what's going to arise in clinic is that you're going to have individuals that come in and they're going to work really hard to achieve their goal in one category, and they may not see the value in achieving excellence in the others. And so as a clinician and practitioner, we need to be able to show and demonstrate the value of these other goals because it's going to at some point relate to their independence and the ability to resist disease in the future.
Chad, I need an example. Let's take longevity. Now, I'm getting a referral in the practice from somebody that has a disease state and the medication is just not working. The lab scores come in a good range, and now what do we do with this person?
Pete, this is a great example. You tend to find client motivation along the indexes that they see the most value in. And so as you reduce an individual's pharmaceutical burden, you're going to do that primarily through upregulating their dietary intake and getting them physically more active. What you want to do, though, is to record the impact of the intervention, not only in their particular index, but as you see as we go further into our program, we do take some of the intake metrics into the other indexes. And this is why. Because overall wellness is tied to an upregulation of all of the scoring. You're not going to be able to maintain long-term independence and capacity if you do not strengthen yourself both on a glandular level and on a tissue level.